So talking about Muslims in Canada, so I wasn't aware there is actually a real-time clock. Do you know that Stat Canada has a real-time clock? So each second it changes and tells you how many borns, how many deaths there are. Were you aware of that?
No.
No? So it was interesting when I was making this presentation. That was, I captured this screen February 8th. And I went there and there was at least the number went up for sure. So now we are coming very close to, so the 6 changed into 9 last night. So we are 38 million in Canada, and Ontario last night, Ontario is now 15 officially.
What is this called? Real life what?
Yeah, so it's called here, Canada's real-time clock.
Oh, okay.
Real time. So you just write Stat Canada real-time clock, and it's very interesting to see the number of deaths, the number of deaths, as the bar goes up and down. So interestingly, as of yesterday, Ontario is 15 million, and we are at 38 million. And the recent stat is 2018. So the people who declare themselves, who declare as a religion, 3.7 at the time of the 2019 stat, they declared they were Muslims. So 38 millions out of these 3.7% are Muslims. So how much Muslims are in Canada? Almost Ontario population, 14 million are Muslims living in Canada. By looking at the stats in diabetes 1 in 10, you can imagine how many Muslims would be suffering from diabetes, right? So as per the current outlook or rise, in 2011 stat, Muslims are 3.2%, and by 2030 we will go high and high, and by 2060 it will be 8%. That's what the predictive thing is. The question is about how many of you know that in Canada, so in world is 1 in 10. In Canada, are we doing a good job or a bad job in diabetes? What do you think diabetes prevalence of diabetes in Canada is? So Maya, you said 1 in 10. What do you think in Canada? Are we doing a good job or a bad job? 1 in 3, 1 in 6, 1 in 10, 1 in 12, 1 in 15, 1 in 20?
The immigrants have made it 1 in 12.
1 in 3.
1 in 3. Yes. Thank you, South Asians. So true. We are doing a bad job. Yes. So according to the 2019, when this Canadian position statement came for diabetes, so 1 in 13, but this is diabetes and pre-diabetic both. So 1 in 3, which makes like 11 million Canadians diabetic, 9% of the population, which is 9.5% are male and almost 8% are female. And surprisingly, they say that every 3 minutes, everyone is being diagnosed with diabetes. So every 3 minutes means like at least an hour, we are diagnosing 24 people with diabetes, right? And the cost is, of course, growing from 14 million. It's now under like 30 million. Now, if we know that 9% of the population of Canadians are either diabetic or pre-diabetic, what would be the Muslim population, which we know that how many of Muslims will be diabetic? Rough estimate. We are 14 million, right? And then, of course, almost, this is 2019. Now it's 1 million. And again, they say it's underestimation. You know why? Underestimation. First of all, there's always a high risk of diabetes in South Asian and Middle Eastern people, and then we are not doing a good job in underestimating diabetes. Look at the stats here when I show it at the back in Canada, that we are not doing a good job here. 6 million Canadians will live with pre-diabetes, and half will develop type 2, and we do not even know about it.